My name is Jolie Neto. I'm going to be demonstrating the IV push. So you're going to want to verify the doctor's order against the MAR. You're going to want to make sure that you have the medication and the flush prior to entering the room. You're going to want to knock on the patient's door, cleanse your hands, and you're going to want to verify the patient's name, date of birth per their bracelet and the MAR. And you can also ask the patient to verbalize their name and date of birth. You're going to want to obtain a baseline set of vitals, blood pressure, pulse, respirations, SpO2, temperature, and you're also going to want to assess the patient's pain level since the medication is for pain. Once you've assessed and verified the patient, you're going to assess the patient's port. So you want to make sure that there's no redness, no infiltration, no signs and symptoms of infection. You're going to want to cleanse your hands. You're going to want to put gloves on. And then after you put gloves on, you want to verify if the patient is already on a IV drip. You want to verify that the drip that the patient is on is compatible with the medication you're giving. If the medication and drip is not compatible, you're going to want to administer 10 cc's of a flush prior to medication and 10 cc's of the flush after. If the IV solution and the medication is compatible, you only need to do 2 cc's of the flush prior to the medication and 2 cc's of the flush after the medication. So you're gonna wanna cleanse your IV port with alcohol for 15 seconds. You let it dry. You're gonna want to put the flush on the IV. You're gonna wanna unclamp. You're gonna withdraw for blood return to make sure that it's patent. You're gonna push the 2 cc's of normal saline, and then you're gonna remove the flush. You're gonna cleanse the tip again for 15 seconds. You wanna get your medication. And then once it's cleansed, you already put the 2 cc's of the flush. You connect your medication. You're gonna wanna educate your patient that they might feel a warm flush, that this medication could make them drowsy, could make them sleepy. So you want to be extra cautious for safety reasons. Make sure they have their call light and make sure that they know to call you if they need to get out of bed to avoid any falls or any injuries. When you go to administer the medication, you're going to want to push the IV, the medication. You're going to want to push it slowly for the first half. And then you are going to wait a minute. So you're going to count a whole minute. Then you administer the other half. Then you wait a minute and you administer the remainder of the IV push. At this time, you can disconnect it, cleanse the flush. You need to wait a minute prior to flushing again. So after 1 whole minute, you're going to flush again with 2 cc's. You're going to remove it. Prior to the medication push, you're gonna have paused your machine and kinked the line. So that way the only medication or the only solution your patient's getting at that time is the medication itself. So after you've finished your medication administration and the second flush, you're gonna unkink the line and press restart on the IV drip. And again, if the patient was getting an IV drip that was non-compatible, you would do 10 cc's before and 10 cc's after. The medication is going to take 5 minutes to peak. So you're going to want to come back to the patient's room and reassess the patient in 5 minutes for vitals, pain level, and all that, and make sure that there's no reaction to the site of the medication for the IV. You're going to want to reassess the patient's pain level, respirations, SpO2, blood pressure to make sure that the patient doesn't have a reaction to the medication and to also make sure that the medication is effective for the pain level. And that's my demonstration on IV push.